And action.
Hi, everyone. Welcome to Movement Matters with 3 clinicians and a mic. I'm Veronica, PTA.
I'm Jessie, DPT.
And I'm Christiane, the PTA as well.
So today we're talking about core strength, how important it is for everyday life and everyday function. And we wanted to give you, as we have 3 degrees and 3 clinicians, different degrees of rehab. We've been talking about peds, but today we really wanted to go into things that can benefit maybe an older population. And we have our core expert over here, right? We call her the anatomy queen, but people also call her the core queen. So
it goes hand in hand.
Sure. Okay. So again, core. Why is it so important? If you ever have thrown out your back when you're doing something, I think everybody has a little bit, right? Or if you ever just kind of fell off, had a hard time doing things, you're like, man, I feel unstable. That is all related to core strength.
Or maybe
when someone tells you to straighten up and you want to get into that straight posture, and then you feel that straight posture is actually uncomfortable.
Right, it's work.
It feels like
another one. If you sneeze or cough, and particularly women, if you happen to release your urine, pretty much pee if you sneeze, that could actually be a core issue, right? So there's quite a few things for us to discuss. We said we're going to break it down, right, Doc, into different episodes?
Yeah, core is a big deal. It's super important, and a lot of times there's a lot of misconceptions about it, which we're going to get into.
So I think the first misconception is that what is core? People are like, what? You're talking about having a six-pack? Doing abs? Like, what is core? So maybe you guys could elaborate a little bit on that.
For sure it goes beyond the six-pack abs, right? And maybe we could talk a little bit about the muscles that actually make up core. And before I hand over the mic to Chris, it's an emphasis, and I want to make sure that everyone knows that core is not just the front side. We have a back side and the sides as well. So
and even a muscle like all the sides,
all around. Right? Yeah,
and the pelvic floor also. I mean, it's in the bottom, but it's like the whole thing.
Yeah.
And the top.
Yeah, as a matter of fact, I have a friendly model here today. Yay. And I know, I like this model because I don't mind that, they got no arms and stuff. It's been used. But the truth is that I like this model because, as my girls were saying here, a lot of people often say, well, let me go ahead and do some core workouts, and they'll do crunches. And that's just one tiny mini part of the core, okay? Like my girls were saying here, can't really pull, but if you guys can see the back here, you have some pelvic floor muscles that are in the back, like the rectum, all right, where you poop from. You have core muscles that are coming from the bottom, the perineal area, all the way to, if I remove, so if we're all to like just pop our trunk open. That's funny that I said that way, but if we can pop up our front open, you can start to look at muscles that are the inside. I mean, I can give you some names. Just the abs, as the girls were saying, it's called, we have 4 of them: rectus abdominis, transverse abdominis. So you can see how I flip the core to show you, flip the trunk to show you the transverse abdominis, how deep that is. Then you have your internal and external obliques. Okay, I think everybody knows that. But then if you guys look a little bit further in here, you're going to see a lot more muscles down here. We got the diaphragm that's cutting the thoracic cavity to the abdominal cavity. It's kind of dividing that. We have quadratus lumborum here in the back. You have the tiniest ones in the back. Very important spinal stabilization muscles. All of those, when working together and 360 movements, they're called the core. And now, depending on how far you're going and how deep you're going to, you can even divide it into lower core and upper core, which then includes all of the shoulder muscles, okay? All of them, including scapular muscles, neck muscles, front of the neck muscles, pectoral muscles. I mean, I'd be listing muscles
basically
forever.
Anything that's stabilizing like this whole
area.
Trunk from the top of your neck all the way to the bottom of your perineal area, your right down there.
Pubic.
It's our podcast, so you can say PP.
Like that is so offensive
Yeah.
anyway. Leave the pediatric therapist to give you PDA. I was gonna say something a lot worse. Trust. But yeah, so guys, this is for us, the first part is that's why I feel like we're gonna have more than one episode with core because we can't possibly cover this whole thing in 30 minutes because just understanding the musculature, when it kicks in, when are you using it, and then how many exercises are not quite strengthening the core.
Right.
Some might require a strong core,
Right.
but they're not targeting the core musculature. So I'm gonna
So
give it back
let's
to my girls.
talk a little bit about some functional activities that we may use in our everyday life that require this core that we're talking about, right?
Well, the answer is everything.
Right. Yes.
So we'll
And
give some
end
more
of the
specific
podcast.
examples,
Yeah.
right?
Right.
And here we finish the
so
podcast. We
what-
use core with everything.
Right. Yeah. That's
Everything.
it. Done. Getting our groceries, right? Lifting them, putting them away, right? Sitting at a desk right now is actually requiring core, especially depending on how we're activating specifically.
Mhm.
Walking uses core. People don't realize that when we're walking, we're using our core because it transfers the energy and it helps us be more efficient in our walking.
Right.
Even rolling, getting out of bed in the morning
Yeah.
is important.
If you've ever had a pain, whether it was wherever, like in this area, scapular, your back, your abdomen, when you're doing, again, anything, but a lot of these things that we just said, when you're trying to get out of bed, you feel,
You're like, oh, there goes my back.
That hurt,
That's a
right?
good point.
oh, I'm
Which
all of that.
Which is a good point that you don't
need it
realize.
all the
Yeah.
time.
I'm gonna walk out of the thing right here because I'm gonna grab my book because I do have the definition of core that I took. So I want to read before we go a little bit further into it. But to your point, I think that it's often when we don't know we use the core for everything. That everything
Yeah.
starts from the center and goes out. Doc, being a neuro specialist, you can give you all that.
I'm going to say that soon.
Yeah, right. But with that said, you don't realize until there's a problem. And then you're like, wait, it was never that hard for me to get out of bed.
Right.
Wait a second. I could carry my kid. Now I can't. What's happening here? So can I do a little?
Yeah,
Sure.
So one of the things that I do as a PTA, and I've been doing this for a while, is I write stuff. I'm an author. I'm a published author. Yay! So not try to plug my book too much. We can definitely put a little information about it. But I do have, because they call me the core queen, I do have like a whole part here on core. And I want to read to you guys because this book, I do have a lot of evidence-based references, like about 30, 35 of them. So it's not something I made up. I literally took it from the book. And the book is Davies, which is like an anatomy book, the author. And it literally says that, sorry, I got to find, go ahead and tell them, go the next thing, and I'll find the actual exact definition here.
All right. So she kind of mentioned about everything starts from within and moves out. So in therapy, we have a saying that's called proximal stability before distal mobility. And basically what that means is that, and I can't help going back to PEEVS in our development, is that we develop our core first before we're going to do are things that require more fine motor things. So think about it. Babies will crawl maybe first or do rolling before they are actually picking up little objects and manipulating with their hand, because we have to have the stability closer here in our core, in our trunk, before we could really do anything else with our limbs.
It's almost like growing, right? Like a little plant growing from the inside out.
Inside out. It's a perfect analogy. And therefore, that's something that stays with us regardless of where we are in our development, whether we're a child, an adolescent, an adult, or an elderly person. It doesn't matter. We need core strength. This is not an age limit thing, okay? This is throughout the ages.
Lifespan.
It's a whole lifespan of it. We need proximal stability before distal mobility.
Okay, so I found it. Why, and this more about like why should you strengthen the core? Strengthening the core will allow for optimum acceleration and deceleration of the kinetic chain of the body. It is over a 360 degrees of movement. So whenever your body's trying to accelerate or decelerate and deal with the different perturbations and challenges from all around them, from the back, from the front, all of that starts from what Doc is saying, starts from that inside stability to the outside. There's so many examples that maybe we can save it for the second episode of how many people we have helped as therapists over the years by you going in, looking at a patient and being, how am I even going to make this person stand up? They're literally, for lack of a better word, in a deathbed. They're literally laying there. And you just start with okay, let me start to activate, drawing in maneuver, tell them to suck in the stomach, bring the umbilical in and back. And just those little things will start to connect their brain to the rest, much like my analogy where the plant starts to grow and then the stems start to get a little stronger. And only with that strong base foundation of the soil and the strong trunks, you can have flowers, right? So that's kind of like what I'm trying to make that analogy with.
So basically what your definition in your book there is talking about the forces that are being able to transfer from the inside to our limbs, whether it's upper extremity or even lower extremity.
Yes.
And another big takeaway from core, the importance of it is that it helps prevent back injuries. I think there's what statistic, 80% of the population at some point experiences some sort of
75 to 80%. You know,
that's a lot.
And I think nowadays, Doc, just to add to that, is the amount of sedentarism, if that's a word, we're experiencing because everything is handed to us. Okay, you got people driving food to you, a grocery shop being delivered to you. Yeah. You know, you might work at a desk job and you're sitting the entire time. You know, and then you're driving and then you're walking and sitting on the sofa. So I think that even now it's even worse. And then you have the phone. Right, so you're looking down, so that's affecting the upper core, which is affecting the lower back, which is affecting the entire core part, you know, the entire ability to complete this functional movements. And so that's where a lot of people are missing out on the right exercises to activate your core.
Which is perfect that you.
And I want to throw in some research that I looked up because I always like to be the one to kind of bring this in because again we are physical therapy specialties and a lot of people out there are putting out information on social media and all that stuff and you should always be seeking and questioning things. Anybody can say a lot of things, and it's easy. I do it too, right? I'll see a meme. It says ice cream is good for you, and I'm gonna be like, yes. I don't read the study.
I'm consciously accepting that
one. I accept. Like, just no questions.
I'm not gonna dig into that one.
When we talk here, we want to make sure that you guys understand that we're coming from a place of, again, research, study, evidence. Like we're looking at books every day as professionals in the field. So we want to make sure that you trust us with that information. So I like to bring up the research. So speaking of the back pain aspect that you brought up, I found, again, I just do a quick search of whatever the topic is and maybe find some of the recent studies. There could be many more, but just to bring up that there is evidence out there, right? And there was a study done in a Mexican rehab hospital that looked at comparison between Williams trunk flexion exercise, which is like those abs and whatever, and core stabilization exercises for patient with chronic low back pain that had spondylolisthesis. And actually, funny enough, the study found that both worked. Okay. But they did have reduction in their low back pain and symptoms and more function. Right?
The core group.
Both groups. Okay. So actually that study found that could work for
either way. In other words, have your trunk strong.
You're working the core, right?
Okay, good.
Then there was another study that I found that was with military professionals. Okay. And they were just seeing does core stabilization stuff again versus sit-ups, which one's better, which one works more. Because the military, especially, they're like sit up, sit up,
Yeah,
sit up.
full
They
sit
love their
It's part of
sit-ups.
their,
It's a
part
bigger
of their,
one, so they're like, what if we don't do sit-ups, right? What if we do it another way?
right.
And they found that eventually in their work activities, those military professionals had a low back pain or musculoskeletal pain. Not necessarily because of the core exercises, but just with what they're
In general,
doing.
because they're carrying
But those that did the core stabilization program had less days out of work,
Okay.
Okay.
right?
Cool.
Good.
So both groups experienced pain. Both were working their core, but the ones who did more core stabilization had, I guess, faster recovery than
Okay.
those who were just doing like the sit-ups and
Yes.
stuff like
Now,
that.
I don't have the research, but since you're on the research topic, I'm going to jump in because I did pull this up. I'm the one who teaches this. We're professors for a physical therapy program if you're new to our podcast. But so that's the class that I'm the teacher for most of the time. But anyways, I found the research, and what struck with me, and so I don't have the research, I can't read exactly, but what struck with me that on that research was when you do a movement, any movement on your upper body, including your neck, your core will kick in fractions of seconds before you actually move anything.
Mhm.
And then for the legs, it was almost a full second.
Wow.
Now, you might sit here and tell me, well, what is a second? Well, if you ever watched a race car driving race, like a race car
Yeah.
or Formula One, you know that
A second
a
count.
second counts. I mean,
Yeah.
basketball, you look at a
Yeah.
second.
Yeah.
Right. Like the
Yeah.
1 second can save
Yeah.
a game.
Yeah.
So for me, that was mind blowing because yes, both parts, upper and lower body, will have you much what you said, proximal to distal. It will have you first activate the core to then move the rest.
Amazing.
And to prove that on a research for me is like, why aren't all the schools, the physical therapy clinics, the phys ed teachers are going to core strengthening
Yeah.
with
As
all
the
that.
go-to.
Start
Right.
with that.
Right.
Well, part of our curriculum does stress body mechanics, and one of the concepts is to set your core
Right.
before you lift a patient, before you do stuff, and
Can
to teach
we
our patients that.
take a minute to really discuss the difference between what you were just saying in the research? Like, what is a crunch versus a sit-up versus stabilization? Because maybe our viewers don't have any idea, like, oh, I thought I was stabilizing my core, and it ends up that they're only doing abs, right? Which is the one muscle that we've been told.
Right.
So the myths sometimes are
Yeah.
core is abs, and sit-ups are the
Abs.
one.
Yeah.
Right? And again, not to say they're bad, because you saw some of the research shows that sit-ups work.
Right,
too.
absolutely.
We need our sit-ups, but it's not the only thing.
Yeah, and then I want to add to that. So yes, absolutely, you need to do sit-ups, but nothing in our body works just one way. So you're going to do sit-ups, you're doing, so I'm going to turn sideways here for a second. So if imagine I'm on my back, right? So I'm doing sit-ups and I'm curling and I'm curling and I'm curling. I'm bringing my body into flexion, flexion, flexion. Okay, what happens with extension?
Right.
So unless I'm also doing extension exercises. So I like to say that these are incomplete addressing the core. Like you're being incomplete with it. Is it going to start you on something? Yes. So let me be clear with a perspective of physical therapy. Trunk stability is the beginning of it all. Like Doc was saying, oh, they can roll in bed. Let's work on their trunk stability. So some people might say, oh, that's core. Well, you can say that's phase one of core, possibly because you're initiating the activation of these muscles that are deep segmental muscles that you have to try and activate. But the research and the books will tell you, in order for you to actually work your core strength, you've got to hit it from all the angles. A crunch on a flat surface is not hitting you from all the angles. And I'm going to give an example. Don't be too impressed because I have a dress on, but I will get on the ball. Okay? So if I'm doing the crunch, I hope I'm able, you guys can see me here. But if I'm doing the crunch on the ball, I want you guys to see just by looking at it how the ball is fighting to throw me off. Which now, instead of just doing a forward movement, I'm having to fight the lateral movement, the side movement, and if I don't control it, I'm going to roll right off. Okay, so that is a perfect example that if I wanted to progress from a crunch or a Superman exercise, then even a Superman exercise, if I go here on the bar, see now I'm having to work all of what's happening here versus on the ground. Now, some people may not be able to get on the ball.
Right.
That,
And I will say this though, funny enough, going back to another piece of research that I found, it was about MS patients. Right.
Right.
So if you don't know what that is,
multiple
multiple sclerosis.
Yeah.
And they did a core program for MS patients to see if it improved outcomes as well
Nice.
with their walking and their stability. Right.
Okay.
The outcomes were measured with this test that we call the mini BEST, which is like a balance assessment.
Right.
Right. And there was like another assessment. They use a trunk stability assessment or something. And the way they did the core exercises was using balls.
Wow.
Cool. Okay. One thing that I really do, and this comes just some examples since we are talking a little bit about how can you change that right away. You know, first of all, guys, you got to think safety first. I do this a lot. Core Queen, they said in the beginning of the episode, is because I do. I use it a lot on my exercises, and I teach it. I use it with my patients. I teach my students. So I've been doing this for a while. I've built that stability, that controlled mobility. You can't start right off the bat with something that difficult. But I'll tell you what I do with my patients, and these are 70-something-year-old patients. Yeah. Okay, I'm talking about, let's talk about my mom. My mom is 79, and I work with my mom. If she cannot get on the ball, what I do is, can I grab the ball real quick? So if you go home to the sofa, so obviously not this, right? But if you have a sofa, and you can start even putting the ball on the sofa, and just having them lean on it and try to work a little bit of that instability. But then the sofa is safe because it's a little bit cushioned, so the ball is going to kind of have a little bit more support.
Right.
If you have, and then it's a great way to start. So don't think that you have to get on the ball just like I did. You can start little by little. There's the half ball, right, Doc? So this is called the Bosu ball. Little trivia information. It's called Bosu because it's both sides utilized. Never going to use that for no reason, but yeah. But what I like about the Bosu is that it gives you that instability, but it has a flat surface.
Right.
So now it's not as hard for me to balance on it. Right. I mean, like we said,
and that's for their patients. I mean, these items, but cushions.
Right.
Pillows.
Yes.
That's another point. Like, do they need all this gym equipment to do core?
No. What we need is an unstable surface or an unstable challenge. Okay. So as an example, if you're working with someone, again, I got to stand up again. Sorry, guys. If I'm working with someone and they have a wide base of support and they're very stable, and, you're not getting challenges from different places, you may not be right. But if I go into, say, what we call a tandem stance, okay, now my foot is in front of the other. And then she, as a clinician, starts to give me different perturbations from around me. Now we started to add the different directions with an unstable. Now the floor is not unstable, but my stance is unstable, which is forcing me to find that center. That's a good precursor to something a little bit more advanced.
And for your level, right? Because you're not going to do it, like you said, standing on two legs.
Right.
But tandem stance, single leg stance.
Right.
Makes it.
Then go to the carpet.
Right.
Do it on the carpet.
Right.
Do it on the grass. Do it on the grass.
Right.
Now you just gave that little terrain another extra acceleration, deceleration that is not predictable.
Right.
You see, this is what makes the core get stronger, is the unpredictability of you needing to respond and use your reflexes, your head riding reflexes to find the center again and then be able to utilize your limbs. So that's really what core is about.
Okay. So if you had to summarize that aspect of exercises, would we be able to give our audience a quick little kind of progression? What would be simple core stabilization exercise versus a little bit more challenging versus like ultimate?
Okay, so I'm going to give the floor to you because since you work with kids, you're DPT, you're the one who assesses all of these things and send those people to me. maybe you want to give them the simple ones. Those are
Right.
easy ones,
Right.
and then maybe we can add more, right?
So basically we have to know if they're weak, right? How do you know if your core is weak? Maybe you think that it isn't. So there are ways that we functionally assess that. It's called MMT testing. So there's different ways to do MMT testing. Of course, there's a whole series of that, but that's one way to know that. Also, if you get fatigued and tired, if you have fallen before, right? If there's fall risk, sometimes it's balance, but sometimes it comes from core, like you were
Right.
saying, right? Because our
Which
core
Core
is
is
going
a
to
big
help
part
us.
of balance.
I was about to
Exactly.
say, which I want to add to that and make it very clear, straight from definition from the book, because like I'm a crazy person with the book definitions now.
Yeah.
Balance is not core only.
No.
You need to work on the core, on the 360, on the reactive, reflexes. But there's so much more to balance.
Yeah.
Like make that very clear
Yeah,
because
that's a whole other series.
because there's contextual things
Vision,
around you.
energy.
There's a connection between your brain. Like is there, like there's so much, guys. So it is not the only piece of balance.
But
That
it
is
is a
it is a
But it
piece.
is a piece.
It is a piece.
Yeah. Okay. The other thing is low back discomfort. So you slept all night and you wake up with a little bit back pain. That could be a sign that your core is weak. The other thing would be fatiguing. So if you get tired of sitting for a long time or even standing for a long time, then that's a sign that there's a weak core. Okay.
That's it.
Okay. So simple exercise. Back to you. So simple exercise. We start with isometrics, right?
Right.
So holding certain positions.
Okay.
I would say a plank is on the higher end of simple. Okay,
Yeah.
there's modifications of that, but it's not any of the movements and perturbations, which would automatically put it in a little bit more challenging.
Correct.
Okay, abdominal bracing is where I would probably start with, and diaphragm work, to be honest with you. A lot of people don't know
I agree.
that where the position, like you were saying, pulling up and in, that's your belly button, that's your diaphragm. So starting with that and making sure that in every position you get in, you have that. Right?
Yeah.
So sitting and standing, while moving, while grabbing, just being conscious that your core is there and that you're activating in the simplest form.
So let me give our audience a little trick, because right there, sitting, watching us, if you're in the car, if you're sitting, if you're on the sofa, I want you to try. If you're laying down, I want you to try that, okay? So it's called the drawn-in maneuvers. What Doc is saying is like the number one, first little thing before I even
Initial piece.
initial piece of everything. It's drawn-in maneuver, okay? So we're going to activate the transverse abdominis and the multifidi that is in the back. So we're going to try to lock those two muscles together. One time, a long time ago, a student said, oh, it's just like if you're going into a very cold water in the pool. And I said, I like that. So I'm going to use that going forward. So it's literally me trying to suck in my belly button and my pelvic floor.
Disclaimer, do not hold your breath.
Up. Yeah.
While
With that said, while
we're doing it
breathing.
right now.
Right.
We're still talking.
Talk about this,
Yeah.
right? And it's pulling in and back. So if like that what the student said is cool, because if you go into a cold pool, you go like that, right?
Yeah. And you're
and you're doing the and then you're doing the drawn-in maneuver. And the gym, we call it the vacuum. Okay, in our field we call it drawn-in maneuver, and it's the number one, day one of injuring your back. Is one of the few body parts that we say don't rest it. Start activating that deep segmental core muscles, and that is the one little that I can give you guys is, and that kind of goes back to our moms, right, and grandmas. Stand up straight, put your belly inside. Like they sort of knew it without knowing it.
Yeah.
But that's what that is. So
And this is something that you could do, like you were saying, all the time. You wake up, you brush your teeth. While you're brushing your teeth, make sure you're engaging your core,
absolutely.
in the shower, like whenever,
and
you're carrying things, you're picking up objects, just having that core engaged.
And so our core muscles are endurance muscles. They're supposed to hold you up over time.
Yeah.
They're supposed to withstand that fatigue.
Yeah.
So first find it and figure out if you can do it, and maybe hold it for a little bit if it feels weird to you. But the point is also to hold it for longer periods, right? Like you don't just want to be like, that's not a start. But that's not the point of how those muscles work, right? So the way you can advance that is just having them hold it over time,
Right.
and then
Yeah.
while doing something like
100%.
that.
And with that said, every day a little bit, and when everything, much like any habit you want to create in your life, it has to be first a conscious effort. I'm under the analogy queen, I guess. I'm blaming myself, I'm not the queen. Queen this, queen that.
It's okay.
But the analogy here is when you first learn how to drive, you have to be very conscious of everything that you're doing. You have to make sure you're putting and you're fixing and then you're flipping the disc. And nowadays that you've driven for 20 years, sometimes you make it home, you don't even know how to get there.
Yeah.
You're like, how did I drive? Did I run red lights? No, but it's so automatic. But before it became automatic, you needed to make it a conscious effort in not doing it wrong. That's what we're saying here.
Yeah.
You got to consciously be talking about it. And for postpartum moms, that's a big deal. I suffer that a lot because I was always like, I was worked out, so I always had a pretty good tight, core. I've always done core. So when I got pregnant, I remember fighting the belly. It was the funniest thing because the belly's trying to grow and I'm like, and then finally I learned to relax and then to relearn. Because once I had the baby, now I'm all
reactivated.
I'm like, why would I get this big belly? Oh man, I gotta start that all over again.
And that brings up a good point because there's a time where it becomes automatic.
Make sure it's recording.
There's a time where it becomes automatic, but even in those times, you can have periods where you lose it or you don't. Like anything that we do, you become good at something, and then all of a sudden you kind of stop doing it or stop being aware. So again, just always be aware of it. Always think about your posture. We all get tired and then we go like this for a little bit, but it shouldn't be then the rest of the day like this, right? Like,
and I like what you said earlier, Vero. You said one of the biggest things we teach right early, very early into the physical therapy programs, and I'm sure DPT the same, is what you said to set the core before you do for things for body mechanics. That's the whole part of the curriculum. Yeah. And I think that kind of goes right there because yes, I'm strong. I have a strong core, all of that. But if I have to lift something super heavy or if I have to, I literally consciously brace.
Yep. I was just going to say,
breathe out because I don't want to pass out, right? Because if you hold your breath and then you lift, now you're causing a much worse problem called Valsalva maneuver.
Not good.
Pass out. If you have a heart problem,
not good, yeah.
But so breathing, right? Diaphragmatic breathing and being able to breathe. Put your hand here. Put the other hand here. Breathe on the lower hand. Babies are belly breathers. They do that naturally.
Yeah.
We lose that.
Lose it, yeah.
Isn't that weird? But it shouldn't be because 75% of your
because we're conscious of our belly.
Maybe. And it's funny because once I started using diaphragmatic breathing for running and biking, that minute that you get that oxygenation comes so much faster.
I know. And our singers too.
But it's weird because when you're running, you want to keep it braced, but then at the same time, you have to be like,
right.
Yeah. It's no joke. It'll take some time. With that said, maybe you need to hire a PT for that, just a little bit.
So, yeah, again, when to seek out maybe more information, a provider is when you, again, in any reason, but really specialized conditions, like we were talking about spondylolisthesis a little bit, we kind of brought it up, MS and stuff like that. We can really evaluate which aspects of your core are the weaker ones because, like we said, it's so many things that, again, you can do crunches, you can do spinal stabilization, you can do multifidus, you can do extension, whatever, you can do rotation, but you don't want to just go and do everything. Like you really want to tailor things to make sure you know exactly what the problem is,
progress
and that can help us
safely. A lot of times, people think that by adding weights is how you progress, and I love how you said your core muscles are postural muscles because that is a huge thing about that, and we should do a whole episode on neck posture. Period. But as a good example of that is your head weighs 12 pounds on top of you. And as you keep moving it to look at your phone, it triples and quadruples. I mean, it gets to a point where if you're looking down on your phone for this long,
it's
gravity.
A physics thing. Center of gravity.
It's about 60 to 65 pounds. Now, the muscles that are in the back are tiny. The muscles that are in the back, they're tiny.
Tiny muscles.
The biggest one you got is the upper traps, and then in the front, the sternocleidomastoid. But unless you're a wrestler or a car driver, a race car driver, where you really need to strengthen it like a weight, you don't. And so with that said, it doesn't have the ability to hold your head for so long.
Right.
So many people with neck issues. That trickles down to the position of the spine.
Also
and trickles down to everything, guys.
Yep.
Yeah.
Yep. So,
Okay.
all right.
So what are we at?
So some take-home messages.
Yep.
Oh,
Okay.
cool. Okay.
Core strength is, again, the foundation of movement, the foundation of posture, the foundation of every day. Okay.
It's definitely about function. So this is something that we could incorporate from when we wake up until we go to sleep, making sure that we are bracing, right, and activating our core. It's not about if your six-pack looks good or not.
I always tell my students, I try to work my core and I don't have a six-pack and I'm not going to have a six-pack. I have a belly on top of my core, but it doesn't mean
I was about to say,
that it's not there.
Yeah.
a six-pack, you guys, honestly,
It's
we can
about
do a
body
whole talk on that. This could be a for everything because
Yeah.
a six-pack is really to do with the diet, your amount of body
nutrition.
fat, your nutrition. You know, you have a brand new baby. I mean, she's not brand new, but you're still going through that. Like there's different things. And you are 100% correct. And I'm going to use that. Just because somebody might look a little bit more on the thicker side or on the skinny side
Yeah.
doesn't mean anything in that sense. It doesn't mean that the thicker person is weak and the skinnier person is stronger. It doesn't mean that even cholesterol. It doesn't mean that the thicker person has cholesterol and the skinnier doesn't.
Right.
Okay, so we can't just judge the book by its cover.
Right.
You can certainly do a little bit of judgment at points here and there because it's natural. In our profession, we judge how you walk, we judge how you move, but we're not judging how thick you are. We're judging your function or your posture, all of that. And you should look at that because, guys, 25 years in this field, if I could tell you what I see the decay of the human being is lack of stretching, so lack of range of motion and lack of core strength. And that is the decay. That leads to so many problems that right now it's linking to Alzheimer's. It's linking to neurological issues when you don't continue that connection.
And in physical therapy, we do it for everybody. Children, in our peds therapy, older adults.
Oh, that's my go-to.
Condition, CVA,
I'm gonna plug
multiple sclerosis, anything.
a little commercial. Watch our Tummy Time podcast because that's core.
Yeah, that's
It's 100% core.
100%,
So very
100%.
important, and you see the difference. Just this week, we had a testimonial of someone following our instructions on Tummy Time. The baby's not even a week old and is already like picking up the head.
looked so
It was
straight. It was so good.
fantastic.
And I want to say, yesterday I saw a patient who's a rotator cuff tear. I mean, repair, surgery. He's already at 12 weeks. But funny thing about core, and again, we can do a whole nother thing about it, but he was feeling a little pinch. He was feeling a little something. And my approach was, you know what? He's a lot more active now because it's far after the surgery. And I have been doing core with him, but I haven't done it in the last couple of weeks. So I said, you know what? This is a problem because we have so much of gravity and controlling that if our core doesn't pick it up where it should, right? If it doesn't pick it up, guess who's going to suffer with it? The joints.
Yeah, the distal
things. So if I'm picking something up above my head and I don't have the core strength to do so, my shoulder muscles are going to work that much harder and be that much more of a
I could do a little challenge for everyone. If everyone would get in the worst posture where they're all flexed, like completely just bad kyphotic posture, and try to raise your shoulders up, see how much range you get.
You don't go
Not a
past
lot.
that.
Now, if everyone goes and engages the core, sits up nice and straight, engages the core, now you have that full range of motion.
And that also leading to the excursion of the muscles. I mean, that what Doc is actually giving you guys here is called the passive insufficiency of the latissimus dorsi, which is so fully stretched that you can't go anywhere. And that's a great point. If you're not in the correct posture, even your muscles are not going to move the way that they're going to move.
I mean, try the drawing and maneuver, with certain activities, lifting something heavy, like find something heavy at the gym or whatever that you're like, I wouldn't normally lift, but try it not activating and then try it with the drawing in and notice the difference.
Yeah.
Try to stand on one leg. If you're not so good at that, try to do it without not thinking about your core and then doing the drawing in maneuver and see the difference.
That's what I do at the
come
lab
back
when I do
and
it.
comment if you did that. And I bet you that everybody will say they notice the difference if they're not already doing it.
So I think to wrap up, I want to say this, guys. In order, what I like to debunk from pseudoscience and things that I see out there is, you know, understanding what it takes to work something. It means it's challenging that particular movement. Okay, so for example, and I'm going to use one example with cardiovascular work. A lot of people say, "Oh, I'm doing cardio," but then you take their heart rate and they're working about 50 to 60% of their target heart rate, their maximum heart rate. That target is clearly, by definition, not cardiovascular work. Okay, it's not endurance work. It literally is your heart like this. So you might be feeling, okay? So you're like going up the steps and at a 50,
Your heart's like, I'm bored.
Easy. Easy.
And it's, your heart does not get to like, oh my goodness, I gotta get better until you get, and depends which book you look, but about 75 to 85% of your maximum heart rate. So again, a lot of people out there think they're doing cardio by doing what, Doc?
Just walking. Yeah.
No, hey, listen, you're walking is better than not walking,
Right.
but you are certainly not doing cardiovascular exercises.
Right.
Okay,
You're doing maintenance
Right.
to maintain what
Okay.
you
And
got
hopefully
in,
you're
with that- right.
but you're not improving it.
It's
which is what we're
improving
saying.
it, and that's what I was about to say about the core.
Right.
So if you're saying to me, "Oh, I do walking lunges, I do pull-ups, I do push-ups, I do planks," and that is working my core, I'm gonna say, sorry, it's not. It's maintaining your core strength. You must have somewhat of a good strength to do those exercises, but in order to challenge your core, you need those unstable surfaces that we talked about.
Yep.
That's the takeaway.
Yep.
Yay!
All right.
And that's because movement matters.